This month, over on the Art of Healthcare Patreon Community Journal Club, we are looking at The Science of Empathy by Helen Riess M.D., which was in the Journal of Patient Experience. Wanted to just go through a couple of key points to summarize what I reckon is really helpful for our clinical practice. So empathy was previously thought to just be an inborn trait. You either have it or you don't. However, empathy has been proven to be a neurobiologically based concept that we can train as a skill. So just like our ability to jump high, we all come in with a natural capacity for empathy, much like jumping, but we can improve that with training. And empathy plays a critical interpersonal and societal role. It enables sharing of experiences, needs, and desires between individuals and provides an emotional bridge that promotes pro-social behavior. So in other words, taking action for the benefit of helping someone else. Empathic medical care is associated with lots of benefits, including improved patient experience, adherence to treatment recommendations, better clinical outcomes, fewer medical errors, fewer malpractice claims, and actually higher physician well-being and retention. But even though empathy is vital in healthcare, if we aren't careful about it, we can still create bias in our interactions with people, depending on who we're assisting and how empathy shows up for us. Because we tend to have the most emotional empathy for others who look or act like us, for other people who have suffered in a similar way, or for those people who share a common goal with us. And we see these biases play out repeatedly in communities, in schools, in sports teams, and in religious communities. So empathy is not always an equal opportunity benefactor. So as people, we're evolutionarily wired to recognize and respond to differences and socially or culturally based perceptions. And these can trigger subconscious fears or ideas that threaten emotional homeostasis. So sometimes we have higher levels of emotional empathy for one person compared to someone else. And when this happens, cognitive empathy must play a role when emotional empathy is lacking because of racial, ethnic, religious, physical difference, values-based differences, moral-based differences. But studies have shown that empathic concern is not necessarily elicited by perceived similarity to others or by effective or emotional sharing, but it can be also elicited by valuing the welfare of people who appear dissimilar to us, and by our ability to adopt their perspective, even though they're different. So another important point is that for us as healthcare professionals to acknowledge that when we're emotionally overloaded, when we're overwhelmed, when we feel exploited or burned out, our capacity for empathy declines as a result of the emotional strain that we've under, the emotional labor that we've expended. And it's really critical for us as healthcare professionals and caregivers that we make sure that we're exercising self-care so that we can maintain healthy levels of empathy.